I want to bring you some breaking news now. We were bringing you the data coming to us from Scotland and from England. We've now got the collated data from the Department of Health, which gives us the new number of people that have lost their lives in hospital from COVID-19, and they've confirmed that 9,875 people have now died across the UK from COVID-19. That's an increase on the data reported yesterday of 917. Well, we can go now to speak to Laura Bundock, who's in the newsroom for us, and your analysis on this latest set of data, Laura.
Well, of course, this is soberingly high number of deaths reported, but it isn't as high as the number reported yesterday for the UK, which stood at 980. I think looking at these deaths, we have to take into consideration the fact that they're following a bank holiday, and what we have been seeing is that on a Monday following a Sunday, for example, there has been a lower number of reported deaths. So this may not, of course, be the true picture. Of course, it is only referring to deaths from patients who were in hospital who tested positive for the virus. We know there are a great number of people in communities, in care homes, in residential homes as well, who have also got the virus and who may well have died as a result of the virus. Those deaths will not be part of this figure. It's too early to say, even though we have a drop today from yesterday's figures, whether or not this is a trend. We have to look at the bigger picture and not get too involved with the day-to-day fluctuations in these figures. If you look at the figures for England, though, 823 deaths reported yesterday. And if you look at the breakdown of some of the figures, it's interesting because London, we know, has seen the biggest number of cases. It continues to have the biggest number of cases. But the number of cases in London does seem to be decreasing. And this is something we have seen. We've been told for some time that London has been ahead of the rest of the UK in terms of the outbreak. What we know about the figures in England is that they involve patients who are aged just 11 years old up to 102 years old. So very, very sad when we look at the fact that a child is part of the figures for the UK. But as I say, we need to look at the bigger picture. And what we have been seeing, the small glimmer of hope with the figures, is that the rate of increase of the rate of deaths does seem to be lowering slightly. So when I talk about this, I mean the fact that if you go back to the beginning of April, the number of deaths was doubling every 3 days, whereas now it's doubling every 5 days. But of course, with all these extra deaths, there are countless families, friends and colleagues today mourning loved ones, and that must never be forgotten.
Yeah, indeed. Behind every one of those numbers is a person who meant something to somebody. Important to remember that. Laura, thank you.